So if you have a disc herniation, if you have a tumor, something space occupying, it's going to disrupt that flow of CSF through the meningeal system. And then if you have something like that that is putting pressure against a nerve root or irritating a nerve root, when you increase the pressure on the intrathecal system, on the meningeal system, that will further irritate that nerve root, that irritated nerve root. So anytime you're suspicious of a radiculopathy, if you think there's nerve root involvement from a space-occupying lesion, you want to check for these intrathecal pressure tests. So the first one is not so much a test, it's a question that you'll ask them. You can turn it into a maneuver, but typically it's a question that you'll ask on the history, which is dejerene's triad, and that is, do you have that particular symptom? So they'll have symptoms in a dermatomal pattern, and do they have those when they cough, sneeze, or strain to go to the bathroom? And if they say yes to any one of those three, so if they say, oh yeah, when I sneezed, that really hurt that area, or I got those symptoms into my hand, that would be confirming a space-occupying lesion or furthering your suspicion of radiculopathy from a space-occupying lesion. So it's coughing, sneezing, straining, recreating those symptoms in a dermatomal pattern would be your positive for dejerene's triad. If they get other types of symptoms that are not in a dermatomal pattern, that's what we're going to call a false positive. So say they have pain, but they say, oh, it kind of hurts my neck a little bit when I cough or sneeze or strain, but it's not radiating, then it would be a false positive. So then you're thinking maybe they have a muscle injury or something of that sort, and it's those injured soft tissues that are painful rather than a space-occupying lesion. Valsalva is useful for recreating the strain portion of the dejerene's triad. So we'd like to be our patient for valsalva and for naffzigers.
I will.
Okay, come on
now.
down.
Getting into, but
all right. Yes, everyone loves the valsalva test. So you can have a seat, please. Okay, so for valsalva, what you want your patient to do is, I want you to take a breath in, hold your breath, and then bear down like you're going to the bathroom. Right, so the hand movement is important here. You're going to have that pressure. Right. Yes. And then does that recreate or exacerbate your symptoms?
no.
No, so that's normal. So normal is no symptoms. Abnormal is they say that they have those symptoms and those symptoms are in a dermatomal pattern for your true positive, which would be suspicious for radiculopathy from a space-occupying lesion. False positive, oftentimes people, if they have a low back injury in particular, might have local pain in the low back from those injured muscles contracting around the area. So that's a common false positive that will show up. For naffziger's test, you do not want to do this test on people who are elderly, if they're atherosclerotic, if they have any kind of vascular compromise. We don't do naffzigers. Do you have any of those conditions? You're not obviously not elderly.
No, I do not.
You do not. Okay. So we're going to stand behind our patient, and what I'm going to be doing is compressing both of your jugular veins. So just let me know if there's any discomfort or if you get lightheaded or anything like that. So we're going to find the front of the neck. We're going to palpate for the carotid pulse and really kind of just check one side at a time for that pulse, and come posterior to where you're feeling the pulse. So keep moving your fingers back until you're no longer on that pulse and you're just posterior to it, and then you're going to compress in. And you're going to compress in for 30 to 40 seconds. And just holding and seeing if that recreates or exacerbates their symptoms. And if they do get the symptoms in a dermatomal pattern, that's your true positive, suggestive of a space-occupying lesion causing radiculopathy. If they just get local symptoms, then that would be a false positive. If they get the symptoms in 5 or 10 seconds, you don't have to keep holding. So it's just until the point that they get the symptoms, you got the result you needed. So it's not like, okay, let's see how bad we can make it. You're going to come back off and know that they likely have some sort of radiculopathy from a space-occupying lesion. And those lesions you're thinking about are disc herniation, tumor possibly a stenosis of the IVF in the intradural region of the IVF could also create this positive on the intrathecal pressure test. So any questions about those three? Yeah.
When you get a positive for that, do you send off for an MRI right away?
You don't have to right away. I mean, depending on what else is on the history, if you think that is something that can respond to chiropractic care, you can usually do a trial of a couple weeks of conservative care. If they're not responding, then you want to order the MRI. But typically you'll first complete your exam, see how they respond to care before you send them out. Unless it's highly suspicious of a tumor, then you want to get one sooner. But if it's disc, you can work with them first. Good question. Other questions about intrathecal pressure testing?
Yeah, when palpating, do you roll over the SCM? I think you said to go put a little
You
posterior.
do. So usually you are ending up around the belly of the SCM, maybe even a little bit behind it. Yeah, good question. Okay, so let's go ahead and do our 3